Welcome back to Daytime Ottawa, back to talk about a very important topic. And, you know, I think a lot of people are having fun with the Rob Ford situation, but there's obviously a person that is going through a difficult time, and he has his own issues and his own addiction issues. And it's a sad statement when we you know, constantly make fun of somebody that really needs support. And our next guest offers some great support right here in our community through the Amethyst Women's Addiction Center. And it is National Addictions Awareness Week. We're joined by Sandi Harmer and Cynthia Waldmeier. Welcome to the show. Great to have you both here.
Thank you.
And it's true, Cynthia, you must watch something like this, and it must really hit home, because you see a poor man whose life is in the public eye, and he's going through a difficult time in his life.
Yeah. Well,
he and his family.
Absolutely.
Right?
And it's definitely a family disease. I mean, we talk about that all the time at Amethyst. It's not something that just impacts the one person, but all those related to him or her. It's, you know, something that has a larger impact than just one. And Rob Ford has definitely put addiction, you know, very much at the forefront recently. And it is National Addictions Awareness Week, so that's the third week of every November. And the point of it is really to highlight the issue of addiction, which impacts communities across the country. Really, every Canadian city or town, I'm sure there's someone who's battled with addiction or is a family member who has. But just as important, it's shining a spotlight on some available services in the country to help.
So before we get to talking about the actual services, Sandi, we wanted to talk a bit more about what you guys are going to be working on, what you've been working on, and or kind of bringing out in an official capacity now, especially when it comes to children.
Right, and it's interesting because this year National Drug Awareness Week is focusing on youth prevention, and I just want to speak about a new program that is a spin-off from our Children's Drug Abuse Prevention Program for children 8 to 12 years old who have a mom, dad, or significant other in their life who's struggling with addictions. But the new program is beginning this week, actually, on Thursday, and it's for young girls between the ages of 11 and 14. And what we're going to be focusing on for a 5 to 6 week period is looking at the issues that they're struggling with around abandonment issues, self-esteem, body image, anger issues, fear of you know, their parent maybe using again. So I'm really excited about this new program and putting it all together, and the young women that I'm going to be working with are really so excited about being able to come together. I've been working with them individually for quite a long period of time now, but they're going to come together and get that support from each other.
You know, it's great that you're doing this, because quite often we forget, you know, when somebody is an addict, the impact that it has on other people, especially the children, because it can really affect the children so deeply and in such profound ways. So what kinds of things have you seen in terms of being the biggest concerns for some children who are the children of addicts?
The biggest concern that I've seen over the years, I've been doing this particular programming with children for about, well, since 1986. I've lost track of the number of years. But mainly it's the fear that their parent will use again.
Right.
And they will do anything they can to try and make that not happen. But in the meantime, they continually live in fear and chaos, which creates stress on their life. It impacts their self-esteem, their image of who they are, because they begin to be the caretaker.
Right.
Because they're trying to hold the family unit together. And even when the parent has a significant number of months or years of not using, that fear is still there. And the memories are very vivid and very clear to them, and they will do anything to try and avoid that situation.
Well, you think about that age group that you just described, 11 to 14, and the stress and the social stress that they have on themselves, and then for this to be on top of that makes it so very difficult for them. And Cynthia, you know, I think there's a misconception of the type of people that are addicts out there, and maybe you can sort of, like, what sort of people are you serving that you see come into these centers?
And I definitely agree with you. I mean, it's something we see every year in our annual report. We look at the statistics of the women who come into the center, and a lot of people are maybe surprised to find out that these are very educated women, often women who have university degrees, college education, mothers, women who are older. It's not something which just impacts a certain, you know, subset of the population. Addiction truly knows, you know, no boundaries.
Right.
So we find that every day, and we have waiting lists for our programs. We have bilingual programs at Amethyst, French and English, substance, alcohol, problem gambling, health promotions, And we constantly have waiting lists, so we know there's a demand for these services in the Ottawa area for sure.
What are the most common addictions that you see come to you?
I would say typically alcohol
Right.
is the one we see most commonly abused, but also marijuana, prescription drugs, cocaine, runs the gamut.
Right.
Right. So if somebody wants to get in touch with you, perhaps the family member, perhaps it's an individual who's a user themselves, how do they do that?
Yeah, well, Amethyst is, very anonymous. We don't have any signage on the building we're in. We keep it that way on purpose so
Right.
that, women feel more comfortable coming in. So if anyone's interested, if they have a family member who think could use help, or a woman herself wants to make a positive change in her life, we'd recommend going to our website, which is amethyst-ottawa.org. Or you could call us at 613-563-0363. Find us on Twitter, on Facebook, and all the information you need is on there.
Excellent. Ladies, thank you so much for joining us today.
Thank you.
Really appreciate it.
And a quick congratulations because Cynthia is expecting.
Thank you. That's so sweet.
Congratulations.
He'll be famous now.
That's right.
That's great.
Hey, we've got some more dancing coming up after the break. Don't go anywhere. We'll tell you about that right after this.